Did you know that from November 2025, the way you see your GP in the UK will completely change? If you're over 60, this update could decide how fast you get help, who you speak to, and even whether you see a doctor at all. New NHS rules are rolling out quietly, and many seniors still have no idea what's about to happen. Stay with me, because in the next few minutes, I'll reveal exactly what's changing, how it affects your care, and what you must do before November arrives so you don't miss out on the support you deserve. Starting November 2025, GP practices across England will be required to adopt the new Universal Access Framework. This means every patient, especially seniors, will notice changes in how appointments are booked, who they speak to, and even how they receive medical advice. For the first time, all GP surgeries will need to offer same-day triage. That means when you contact your practice, your request, whether by phone, online, or in person, must be assessed on the same day. The idea is to make it easier for patients to get an appropriate response without long delays. But here's the twist: not every patient will be seen by a traditional GP. Instead, you might be directed to a nurse practitioner, a pharmacist, or even a virtual consultation. This new model is known as multidisciplinary triage, and it's being pushed to reduce pressure on GPs themselves, who have been stretched thin for years. But while this may streamline access for some, many seniors worry it could mean losing that personal connection with their doctor, the one who knows their history, understands their condition, and can spot problems before they become serious. Another major part of this update is the NHS Digital Access Initiative. From November onwards, every GP practice will need to use the new NHS Digital Gateway, a system that allows patients to manage appointments, prescriptions, and test results online through a single platform. This system will replace many of the older booking systems that vary from one surgery to another. For tech-savvy patients, this is great news. It means fewer phone queues and more control. But for many older Britons who prefer to speak directly to a receptionist or don't feel comfortable using smartphones or computers, this could cause frustration or confusion. The NHS says it will continue to offer phone and in-person booking options, but the truth is, digital services will soon become the default method. So if you're not already familiar with using the NHS app or online booking tools, now's the time to get prepared. Because by November, it's not just a convenience, it will be the main way to access many essential services. Let's talk about prescriptions too. The NHS has announced that by late 2025, most repeat prescriptions will be processed automatically through the new electronic prescription service. This means no more calling your GP just to request the same medication every few weeks. Once set up, your pharmacy will automatically receive your prescription when it's due. It sounds simple, but it's also important to double-check your records and medications regularly because any errors in the new system could lead to delays or missed doses. So if you rely on daily medication, take the time now to confirm your pharmacy details, dosage information, and GP records are all up to date. It could save you a lot of trouble once the new rules kick in. There's also an important update for patients living in care homes or those who rely on home visits. Under the new GP access rules, home visits will now be coordinated regionally instead of by individual GP practices. That means a central team may decide which doctor or healthcare professional visits your home, rather than your local GP directly. The NHS believes this will make scheduling faster and more efficient, but it also means you may no longer see the same familiar faces. For some, that consistency of care has been vital, especially for those with dementia, mobility issues, or chronic illness. So it's understandable that many seniors are uneasy about this part of the change. Now, let's talk about something positive, because not all of this is bad news. The NHS is also introducing new elder health hubs in selected regions. These will be specialist centers focusing exclusively on senior health things like mobility, long-term conditions, nutrition, and social well-being. If your area is part of this rollout, you'll be able to access faster screenings, same-day blood pressure checks, full risk assessments, and even referrals to community services all in one visit. The goal is to create a one-stop shop for older adults who need comprehensive care without multiple appointments scattered across weeks. These hubs are expected to expand nationwide by late 2026, but the pilot phase starts in November 2025. So if you're over 65, this could actually make your healthcare experience smoother and more tailored to your needs. Now, let's answer the big question: why is all this happening now? The NHS says these updates are part of its future access reform plan, aimed at modernizing primary care. With staffing shortages, growing patient lists, and rising costs, the NHS is trying to adapt to a new reality, one where digital tools, multidisciplinary teams, and regional coordination are essential for survival. But the key challenge is ensuring that vulnerable groups, especially older adults, aren't left behind. Because no matter how efficient a new system may look on paper, it only works if it's accessible to everyone. That's why the NHS and local councils are now running community training sessions to help seniors learn how to use online health tools. If you're unsure about how to download the NHS app, check test results, or manage prescriptions online, check with your local library, community centre, or Age UK branch. Many offer free classes to guide you through the process. There's also a new feature being added to GP records' digital consent preferences. This allows patients to control how their data is shared between GP surgeries, hospitals, and pharmacies. Starting November, you'll be asked to confirm your preferences either online or at your next appointment. If you do nothing, the system will assume you've agreed to share your data automatically. So it's very important to review these settings carefully, especially if you have privacy concerns. Of course, with all these digital changes, the question of security comes up. The NHS says the new systems will use advanced encryption and two-step verification to protect personal data. However, scammers may try to take advantage of the transition period. If you receive a text, email, or phone call claiming to be from your GP practice and asking for personal information or payment, be cautious. Remember, the NHS will never ask for bank details, and GP services remain free. If you're unsure, always call your GP practice directly using their official phone number. Now, here's something you can do today to prepare for November's rule changes. Step 1. Make sure you're registered with the correct GP practice and that your contact details are updated. That includes your address, phone number, and email, if you use one. Step 2. If you haven't already, download the NHS app or register online for your surgery's patient portal. Even if you prefer to call in, having online access gives you more flexibility. Step 3. Ask your GP or pharmacy about the electronic prescription service. It's free and can save you a lot of time. And Step 4. Talk to family or friends about these updates. Many people don't yet know how big these changes are, and sharing this information can help others stay prepared too. For seniors, healthcare isn't just about appointments. It's about peace of mind, knowing that when something feels off, you can reach out and get the help you need quickly. These new NHS access rules are meant to protect that promise, but they'll only work if everyone understands how to use them.